Are you suffering from seasonal allergies that are causing a stuffy or runny nose, itching, sneezing, or post-nasal drip? Ryaltris 665 Mcg-25 Mcg/spray nasal spray antihistamines can help relieve these symptoms. This nasal spray contains two drugs, olopatadine, an antihistamine that blocks natural substances responsible for allergic symptoms, and mometasone, a corticosteroid that reduces swelling in the nasal passages. It's important to use this medication as directed by your doctor for the best relief. Consider using it at the same time each day for consistent results. Before you start using Ryaltris 665 Mcg-25 Mcg/spray nasal spray antihistamines, make sure to read the patient information leaflet from your pharmacist. Follow the illustrated directions for the proper use of this medication and ask your doctor or pharmacist if you have any questions. Typically, this medication is used in the nose twice a day in both nostrils. Remember not to spray it in your eyes or mouth. Before using the nasal spray, gently blow your nose and shake the container well. If you're using the container for the first time or haven't used it for a while, follow the instructions for test sprays in the air. Also, check the product package for further instructions on when to do the test sprays again. To use the spray, remove the protective cap, close one nostril by pressing it with your finger, and tilt your head slightly forward. Keeping the bottle upright, carefully insert the nasal applicator into the other nostril and press down firmly on the pump to deliver the prescribed number of sprays. Do not spray directly onto the middle wall of your nose, nasal septum. Breathe in gently through your nose and out through your mouth, then repeat in the other nostril. Wipe the applicator tip and replace the plastic cap. Avoid blowing your nose for 15 minutes after using this medication. Use Ryaltris regularly at the same times each day to get the most benefit from it. Do not increase your dose or use it more often than prescribed. Keep track of the number of sprays used from the container and discard the container after you have used the specified number of sprays. Follow the package instructions to unblock the spray tip if needed and to clean the spray bottle. You may start to feel the product working as soon as 15 minutes after the first dose, but it may take several weeks before you get the full benefit. If you do not get better or if you get worse, tell your doctor. Some common side effects of Ryaltris 665 Mcg-25 Mcg/spray nasal spray antihistamines include a bitter taste in the mouth, nosebleeds, and irritation/soreness in the nose. Drowsiness may also occur rarely. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to notify your doctor immediately if you experience any serious side effects such as pain/sores in your nose, white patches in your nose/mouth, or painful swallowing/trouble swallowing. In rare cases, corticosteroids given in the nose may be absorbed into the bloodstream, leading to potential side effects of excessive corticosteroid levels. These side effects are more likely in children and individuals who use this medication for a prolonged period and in high doses. It's important to seek medical attention if you experience unusual/extreme tiredness, weight loss, headache, swelling ankles/feet, increased thirst/urination, or vision problems. While a serious allergic reaction to this drug is rare, it's important to seek immediate medical help if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects. If you experience any other effects not listed, it's important to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Ryaltris 665 Mcg-25 Mcg/spray nasal spray antihistamines, make sure to inform your doctor about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Also, be sure to inform your doctor about your medical history, especially if you have eye problems, infections, or recent nose issues. This medication may rarely cause drowsiness, and using alcohol or marijuana can increase this effect. It's important to avoid driving or using machinery until you can do so safely. Additionally, it's important to stay away from anyone with an infection that could easily spread, and to inform your doctor if you have been exposed to an infection. Long-term use of corticosteroid medications may make it more difficult for your body to respond to physical stress, so be sure to inform your doctor if you are undergoing surgery or emergency treatment. If this medication is used for a long time in children, it may temporarily slow down their growth, so it's important to have regular checkups with the doctor. During pregnancy, this medication should only be used when necessary and under the guidance of a doctor. It is not known if this medication passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Ryaltris 665 Mcg, 25 Mcg/spray nasal spray antihistamines, as they can affect how the medication works and increase the risk of serious side effects. Make sure to keep a list of all the products you are using and share it with your doctor and pharmacist. Let them know if you are taking any other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. Also, check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Always consult your pharmacist about using these products safely. Remember, do not start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much Ryaltris 665 Mcg, 25 Mcg/spray nasal spray and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important to act quickly in these situations to ensure the person gets the necessary medical attention. It's important not to share this medication with others. If you are using this medication for a long period of time, your healthcare provider may want to conduct lab or medical tests, such as nose exams or measuring the height of children. It's also important to avoid substances that can worsen breathing problems, such as smoke, pollen, pet dander, dust, and mold. Make sure to keep all medical and lab appointments and follow your healthcare provider's recommendations for managing your breathing issues. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Don't take 2 doses to make up for the missed one. When you have Ryaltris 665 Mcg, 25 Mcg/spray nasal spray antihistamines, you should store it upright at room temperature, away from light and moisture. It's important to also keep it out of the bathroom, and not to freeze or refrigerate it. And, of course, always keep all medications away from children and pets. When you no longer need this product or it's expired, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance. It's important not to flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.